Hey everybody! Today, we're discussing a topic that is not only important but also critical for every woman to be aware of. Have you ever ignored a symptom thinking it's just a minor inconvenience, only to find out later that it's something more serious? Have you ever put off scheduling a doctor's appointment, thinking you'll get to it later? Unfortunately, many women tend to ignore certain symptoms. But what if those signs were actually indicators of something more serious? In this video, we're going to go over some of the most commonly ignored cancer signs and what you should do if you notice them. Let's get started. Number 1. Changes in menstrual cycle. Women should be aware of changes in their menstrual cycle, such as heavy bleeding, irregular periods, or bleeding between periods. These symptoms could be indicators of cervical, endometrial, or ovarian cancer. But it's important to note that abnormal bleeding is not always caused by cancer, but it's still important to have it evaluated by a doctor. Be sure to schedule regular gynecological checkups, and keep track of your menstrual cycle to notice any changes. Number 2. Bloating. Abdominal pain or bloating can be caused by a variety of conditions, but it can also be a sign of cancer in the colon, stomach, or ovaries. It's important to note that abdominal pain or bloating can also be caused by other conditions such as gas, constipation, or food poisoning, but it's always best to rule out cancer as a cause. If you experience persistent abdominal pain or bloating, it's important to see a doctor. Number 3. Changes in bowel habits. Changes in bowel habits, such as diarrhea, constipation, or blood in the stool, can be a sign of colon cancer. The American Cancer Society recommends starting regular colon cancer screenings at age 45, or earlier if you have a family history of colon cancer or other risk factors. If you notice any changes in your bowel habits, it's important to see a doctor. Number 4. Headaches and vision changes. Persistent headaches or vision changes can be a sign of brain tumors or other brain-related cancers. If you experience persistent headaches or vision changes that are not relieved by over-the-counter medications, it's important to see a doctor. Number 5. Persistent pain. Persistent pain in any part of the body can be a sign of cancer, particularly bone cancer. If you experience persistent pain that is not relieved by over-the-counter medications, it's important to see a doctor. It's important to note that persistent pain can also be caused by other conditions such as arthritis or injury. Your doctor may order imaging tests such as X-rays or MRIs to determine the cause of the pain, and if cancer is suspected, a biopsy may be performed to confirm the diagnosis. Number 6. Change in the breast. One of the most commonly ignored cancer signs is a change in your breast. This could be a lump, a thickening, or a change in size or shape. It's important to note that not all breast lumps are cancerous, but it's still important to have them checked by a doctor. Be sure to schedule regular mammograms, which can detect breast cancer early, and perform self-exams to check for any changes. Breast self-exams should be done once a month, ideally a few days after your period, so you can become familiar with the normal changes in your breasts and be able to spot any new lumps or changes. Number 7. Unexplained weight loss. Another cancer sign that is often ignored is unexplained weight loss. Losing weight without trying can be a sign of cancer, particularly in the stomach, pancreas, or lung. If you've noticed that you've lost weight without trying, it's important to see a doctor to rule out cancer. Unexpected weight loss can also be caused by other conditions such as diabetes, hyperthyroidism, or depression, but it's always best to rule out cancer as a cause. Number 8. Coughing and difficulty in swallowing. A persistent cough or difficulty swallowing can also be a sign of cancer, particularly lung cancer. If you've had a cough for more than 3 weeks or have difficulty swallowing, it's important to see a doctor for an evaluation. Lung cancer can also cause a hoarseness in the voice, chest pain, or coughing up blood. These symptoms should be taken seriously and evaluated by a doctor, as early detection is key in treating lung cancer. Number 9. Fatigue. Unexplained fatigue and weakness can also be a sign of cancer. If you're feeling tired all the time and don't have the energy you used to have, it's important to see a doctor to rule out cancer. Fatigue is a common symptom of cancer and can be caused by the cancer itself or by treatment. Cancer cells consume a lot of energy, which can make you feel weak and fatigued. Number 10. Changes in skin. Changes in your skin can also be a sign of cancer. If you notice any changes in your skin, such as a new mole or a change in the size, shape, or color of a mole, it's important to see a doctor for an evaluation. This is particularly important for any new moles that are asymmetrical, have uneven color, or have irregular borders. These are the ABCDs of melanoma, which is a serious type of skin cancer. It's also important to be aware of any changes in the size, shape, or color of existing moles, as well as any new moles on the skin. These examples are not meant to cause alarm, but rather to educate and inform you about the possible signs of cancer. Thanks for watching, and don't forget to subscribe to our channel for more health-related videos.